Orman Hall. I know his wife is here. She's probably just shaking her head. Orman, why don't you step up and say a few things about your mission?
Well, this is obviously a really big day for me. Not only do I have a new job, but I have a new name. DADIS has a mission that spans all major drug substances. We know that cocaine is still a serious problem in the urban centers, and that alcohol is pervasive across our entire state. And we've also seen a troubling increase in the use of marijuana among adolescents in our state. But the governor is correct. Prescription drug abuse needs to be job one. There are more people dying from opiate painkillers in the state of Ohio than automobile accidents. It is at epidemic proportions. And I really appreciate the governor tasking the DADIS with the responsibility of dealing with the prescription epidemic that exists in our state. Thank you.
And just to add to that, I've been talking to Mike DeWine, who also has a great passion for this, and I believe, will have good coordination between the legislature, the Attorney General's office, Orman's office, and directly into my office. Tracy?
Good morning, everyone. I would like to thank Governor Kasich for granting me this opportunity to serve the state of Ohio in this capacity. It's a huge opportunity, and I think that there is a lot of pressure on the mental health system and the behavioral health system in general, fiscal pressure and other pressures. And so while this is a time of great risk, it's also a time of great opportunity. We can think about how we can approach these challenges differently in the future, both from a fiscal perspective and also from an outcome-based perspective for the individuals who are served. And so I look forward to this and thankful for the opportunity to provide this leadership.
She has a 2-year-old son named Felix. Great name, isn't it? There aren't enough Felixes in the world. Okay, John, you're the superstar here. Go ahead.
Well, you wondered, Governor, like who all these people were sitting out there in the room. And this hearing room happens to be in the same building that my staff were.
Is this a break? Are they paid?
They were thinking, nude press conference, free food.
I got you.
Okay? And they all came flocking down. Now, so a number of these folks are actually my staff, and they're people who have made me look good over the past 4 years. And I just want to say it has been an honor for me to work with the community of folks with disability in the state over the past 4 years. It's been an honor to serve, and it is an honor to have been interviewed for this position. I've told my friends I never had an interview like the interview I had with you. And that was really a unique experience. And the one thing I really learned from that is his passion for the work that we do. And that was something that really got me excited about looking at the work that we've done over the past 4 years, continue to build on that, to continue to make changes. We are still not where we need to be in the field of disabilities. We have a lot of folks with skills that could be working productively in the community that we don't have there yet. And that's just one example of those kind of skills and gifts that we need to work on and release so that the entire state can benefit from these gifts and skills of the folks that we serve. So it's my honor. I'm looking forward to working with Tracy, and it's been a neat opportunity to work through the past, continue to do that, to learn to know, and I'll never get his name right because you keep saying, luckily my name is John, your name is John, okay? And that works good, to work with Orman and other directors as they get appointed. So I'm really excited, and I appreciate the privilege that you've given me to do this.
Thank you, John. And let me just conclude. Well, you all deserve a lot of credit because this is not easy work. I think it's a gift to do it. And, you know, one of the things that I worry about is getting people out of silos and getting them in a position of where they can see a better tomorrow. What dooms us are pessimists or people that they can't see a better tomorrow. They're kind of interested in just taking care of today for themselves. I think if the entire community and the transformation that we hope to have, not just in this area, but all healthcare, Ohio could be a great leader, and that is our goal. Our vision is not to do things the way we've been doing them, to think about doing things in another way. It requires teamwork. So get ready. Some people say I ought to pass out seat belts for the changes that are coming. I know Howard has always said that. He hates that idea. He's a status quo guy. He's old. He's old, though. You know, he can't help himself. So anyway, I want to thank you all for coming. And now I have to turn this over to the press for questions.